Yeah, so I mean, both Tim and I saw Gigi at an event in Brisbane on First Tuesday Club when you presented on your book, The Great COVID Panic, Gigi. So after that, well, among other things, you produced a paper for Centre for Independent Studies. So that's an organisation I've got a connection with. I'm an adjunct fellow there, and you've written this great paper, COVID's Cohort of Losers: The Intergenerational Burden of the Government's Coronavirus Response. So to start off with, Gigi, I'd like to ask you about this estimate you've got in your paper. You estimate that the COVID policies Australia pursued, so we're talking about lockdowns, keeping kids home, keeping them away from school, those COVID policies have cost the nation's youth at least 116 times the value of any benefit that they could have received from these policies. And you say that this is a conservative estimate. Could you tell us, please? I mean, how do you broadly to begin with, how do you come up with a number like that, 116 times the value of any benefit?
So basically, the approach I take in that CIS report, which came out a few months ago, is very similar to the approach I take in my cost-benefit analysis of Australia's COVID lockdowns generally for the entire country, which was published by Connor Court in late 2022. That's a book now that is co-authored with Sanjeev Sablock, who you may also know of through his anti-lockdown statements during the past few years. He used to be a Victorian Treasury economist, and then he parted ways with the Treasury in, I think, September 2020. And fortunately, was between jobs, so I was able to partner with him in producing this larger cost-benefit analysis. And then CIS, well, Matt Taylor at CIS asked me to produce a kind of focused report specifically on the cost to youth. So the mechanisms that caused damage during the COVID period that were really the main ones I was worried about when we started with the lockdowns are the fact that when you lock people down, you're making them stressed and unhappy, right? So there's that one immediate negative effect. And then also the fact that because we followed up lockdowns with these large fiscal stimuli, the JobKeeper program in particular, that we were going to be racking up debt. We're also creating inflationary conditions, which I mentioned at the time, but that seemed to be something nobody wanted to hear. But certainly the debt is basically signing us up to not be able to spend as much on other things in the future. And so for children or young people who are going to be around in the future, of course, that means that they're going to have a less good life in the future because we have accumulated this debt during this period, the 3 years of the COVID period, or the 2 years really, which is what I'm analyzing in the report and in the cost benefit analysis, so 2020 and 2021. And those two types of damage, those two mechanisms of damage, are the major ones that are making up the large amount of cost, which is $116 billion, I believe, that I estimate that the youth will have paid because of our COVID response. Now, of course, doing a cost-benefit analysis, as the name suggests, means that you also need to enumerate the benefits. And so, of course, the benefits that were touted when the lockdowns came in were that we would save people from COVID, right? And as it turns out, and this was true in March 2020, if you actually looked at the data, COVID is mostly dangerous to the elderly or people who are comorbid. So in fact, the average age of COVID death with COVID is basically the life expectancy in Australia, right? And so, really, if you're thinking about the benefits to youth of lockdowns, they're not in the form of saving people from COVID deaths. They are actually more in the form of a few people not dying in traffic accidents or homicides who otherwise might have if we hadn't had the lockdowns. Those are benefits that were not sold as part of the marketing package for the lockdowns initially, but they are benefits. So there are fewer people going to pubs. And of course, young people who go to pubs sometimes get drunk and accidentally off each other. And then there were also fewer people driving cars. And so there were a few fewer deaths from that. So, those were the kinds of benefits that if you were looking for benefits to the young, would count. Now, of course, the question then is, well, how do you compare these costs and benefits, right? Because it sounds like being more stressed when you're sitting at home because of lockdowns is not really in the same category. It's not in the same currency as a benefit that means, okay, I'm not going to die from a homicide at a pub, right? So in order to do this, we have to choose, and this is true for any cost benefit analysis that anyone has ever conducted, you have to choose a currency in which you are able to basically express, quantify the costs and the benefits of the policy or policies that you're evaluating. And so for my cost benefit analysis of Australia, for Australia as a whole, and for the CIS report, what I choose to use is something we call the WELLBY, or the Wellbeing-Year. And this is a new currency, reasonably new. It came on the scene in about 2018 or so. It was the production of a bunch of researchers at the London School of Economics, and it's built from a question that asks directly about life satisfaction. Right? So there's a question that appears on many life satisfaction surveys around the world across time that says, overall, how satisfied are you with your life nowadays? Now, you can argue about whether that actually captures everything that is important, right? But I think in terms of the immediate effects of the lockdowns, it's not bad. It's probably better than alternative statistics that we have access to, like, how many people were thrown out of work, or how much is GDP expected to decline, because it is really directly about human welfare, human well-being. And that, to me, certainly as an economist, that is the most defensible maximand of government policy. It's the maximand that I try to go for when I'm making policy recommendations. I want to recommend policy that is going to maximize human well-being, human thriving from the scarce resources that we've got, right? So I like the currency particularly for that purpose, for figuring out how much people suffered during lockdowns directly. And so the WELLBY is built from this question. The question's answered on a 0 to 10 scale. So 0 is not at all satisfied, and 10 is, completely satisfied. The average answer to that question of somebody in a place like Australia, when they're feeling pretty good and healthy, is about an 8. And the average answer of somebody who is kind of indifferent between life and death because their life is so difficult and painful is around a 2. Though there's some disagreement about this. Some people say 1. I used 2, which means that 8 minus 2 being 6 WELLBYs. So each increment there on that scale is 1 WELLBY. So 6 WELLBYs enjoyed for one person for 1 year is equivalent to basically enjoying 1 year of healthy life. Yeah. And 1 year of healthy life enjoyed by one person is also expressible as what many of your listeners may already know as the quality adjusted life year, the QALY. This is a currency that's used a lot in health policy research, right? And health economics and decisions about what drugs to buy and this kind of thing. So the TGA, our drugs administrator, they use this QALY measure in order to bargain with drug companies when drug companies have new things to offer. The TGA says, well, how many QALYs will I get from this drug? And if the number of QALYs is, let's say 10, then the TGA says, okay, well, we'll buy that drug if the cost is no more than 10 times some threshold value that they'll pay per QALY. And that threshold value tends to be somewhere between $50,000 and $100,000 per QALY. Yeah. So that shows you right there what the sort of social willingness to pay for a healthy life year is in Australia. And that value, by the way, is higher in higher GDP per capita countries, of course, than in lower GDP per capita countries. So as we increase our GDP per capita, so too does our willingness to pay for socially for an additional life year increase. That's why GDP per capita is something we sometimes target in economics, right? We want to be able to afford better and more, and we want to be able to pay more for the good things in life, including more healthy life years for our citizens. Yeah. So what that means is that you can basically translate from WELLBYs to QALYs to dollars. That enables me then to capture other costs like the debt, for example, in its native currency like dollars, and translate back to WELLBYs if I want to, translate forward. And there are some caveats around that translation, which of course I discussed, but that's basically the method. And that's the method that I use in both the report and the CBA for lockdowns. And I find that lockdowns were, as everybody else who has done a serious cost benefit analysis around the world has found, lockdowns were enormously more expensive than they could possibly have delivered in benefits, particularly for our youth who really had nothing to gain from them.